the entire nursing organization, I am so glad and so thankful that you're here to help us celebrate our second redesignation of Magnet. Couple housekeeping. Those of you who are parked in the ramp and you need a voucher, where is Gail? Oh, Gail's in the back waving her arm. If you need a voucher to get out, you can see Gail and she'll give you one. So the Magnet recognition is the highest honor for nursing service excellence that any hospital can achieve. It's awarded to hospitals who deliver an extraordinary level of patient care. Our award here reflects the teamwork and collaboration that exists here at St. Mary's. We provide exceptional care to our patients, their families, and to the community. We could not have reached this level of excellence without the help of everyone in the room here. So for that, thank you for making this award possible. In addition to clinical excellence, an environment that encourages nurses to pursue their professional development is also recognized with the Magnet Award. And my own experience highlights the environment that we have at St. Mary's. I've been a nurse here for 27 years, and it was the past 2 years that I had the opportunity to chair the Nursing Coordinating Council. Along my journey, there have been many of you in this room and outside this room that have mentored me, have encouraged me, and have served as role models. And I thank you for that. I continued both as in a clinical capacity, taking care of my patients in the medical ICU, but then I also had the opportunity to expand my skills in a leadership role. I gained a new perspective as I glimpsed into the administrative side of operations, and that new knowledge I transferred to my bedside care. I became certified in my specialty area in critical care, and I have since returned to school. This year, I have the wonderful opportunity of being the chair of our whole system shared decision-making coordinating council. And this will give me an opportunity to lead the culture change here at St. Mary's, where all departments will have a shared decision-making model. So I'm really excited for that. And it goes to show that it's never too late and you're never too old to invest in your own development. But I do have to admit, one of the highlights of my professional journey occurred in August of this past year, when I got to escort the Magnet appraisers here for their time with us. I quickly discovered, and those of you that know me, as I moved from session to session, I had to make sure that a box of Kleenex was nearby at all times. The sessions, hearing what my colleagues said about their reasons for choosing St. Mary's over other institutions, the personal connections that they had, the personal relationships that they had, either as a patient or a family, was really quite moving. Also, my colleagues that said why, after years and years and years, they continued to stay at St. Mary's. Really, it was really important that our mission and our values was something that we exhibited throughout our daily work. The most inspiring, I think, and to Joan, unfortunately she couldn't attend that session, was listening to the community leaders as they went around the room and said what a difference and what an impact St. Mary's has on what they do out in the community. We, as employees, demonstrate our culture and our values, not only here doing direct patient care, but out in the community. The work we do isn't because we have a policy or procedure that says we have to follow that. The work we do is really a reflection of St. Mary's culture and our values. It's these values of compassion, respect, excellence, stewardship, and community that each one of us brings to life in our daily work. So thank you again for the profound impact that you have on the lives of those we serve. So next, I have the wonderful opportunity of introducing our next guest. Craig Lazinski is currently the director of the American Nurses Credentialing Center's Magnet Recognition Program. He's responsible for program strategic planning, operation, and enhancing the quality of the program on a global scale. Prior to becoming the director of the Magnet Recognition Program, Craig served as the Chief Nursing Officer and Vice President of Patient Care at Poudre Valley Hospital, a Magnet-designated facility in Fort Collins, Colorado. During his tenure as the Chief Nursing Officer, Poudre Valley Hospital has been redesignated as a Magnet facility twice, in 2004 and 2009. In 2007, the hospital was the first recipient of the National Database of Nursing Indicators, American Nurses Association Outstanding Nursing Quality Award, and has been recognized again for outstanding quality in 2008, 2009, and 2010. In 2009, the hospital's Community Case Management Program was awarded the prestigious Magnet Prize for Clinical Excellence and Outstanding Outcomes. In 2008, the Poudre Valley Health System was a recipient of the Colorado Performance Excellent Quality Award for the second time. Craig was an active member of the Malcolm Baldrige National Quality Award leadership team, and the health system received the Malcolm Baldrige National Quality Award in 2008. Craig has a Master's of Science degree in Nursing Administration from Regis University in Denver, Colorado, a Bachelor of Science degree from the University of Minnesota, Minneapolis, and an Associate of Applied Science degree in Respiratory Therapy from St. Mary's Junior College in Minneapolis. Craig is currently a doctoral student at Regis University in Virginia Beach, Virginia, studying strategic leadership in the School of Global Leadership and Entrepreneurship. He's also a 2007 graduate of the Johnson & Johnson Wharton Nursing Fellowship Program. Certified as a nurse executive advanced by the American Nurses Credentialing Center and a fellow of the American College of Health Executives. Won't you please join me in welcoming Craig?
Well, I am so glad to be here. I wish my mom was in the room to hear that. So, she has no clue what I do, although she Googles me all the time, my name, and she has a lot of spare time. But she'll call me and say, "Do you know you said this?" And I'm like, "Oh, I better look that up. I'm not sure what I said." But she keeps herself active. Well, this is very close to home for me. I grew up in St. Paul, and I went to the University of Minnesota. Don't hold it against me. Okay, I'm in Badgerland. Although Minnesota's hockey team's doing really well this year. So, my wife grew up in Wapaka. And so she actually worked at the University of Wisconsin in nursing. And she received she's a nurse also, and she received a graduate degree, clinical nurse specialist at the UW. And we actually were just here about 3 weeks ago. We had a wedding, and so we came back at the Dells to come here. So this is familiar territory, but I'm extremely glad to be invited to come here. You all work in an outstanding organization. If I was looking for a job, I'd like to work here. The tour that I was given by Bonnie is outstanding. I got to tour your NICU. I got a preview. Okay, it's awesome. And I'm a NICU nurse by background, so it was nice to see the advancements since I've been out of the clinical realm way too long ago. We won't go back that far. So I'm very happy to be here. The other thing is I have a family connection. When we were out here just a few weeks ago, my wife's aunt, Marion, she's 85 years old and is a very pleasant, eccentric woman. She's very interesting. We love spending time with her. Actually, my 13 and 15-year-old just love hanging with her because she has all these stories. She was a lab technician in her years, but she had a pacemaker put in this facility. And she had nothing but positive comments, just rave reviews, and she wanted to make sure that I told you about that. If I had time, I would have picked her up on the way here. But then my talk would have been about 50 minutes. Once she gets going, she's going. But anyway, so the personal connection to your facility. In prep for coming out here today, I reviewed your Magnet application, and I get to review all the executive reviews, and it's sent to the facility, so I know that it's probably been reviewed before. But it's extremely impressive, the things that were mentioned as exemplar practices. And one of them is Joan's leadership in the role of Chief Nursing Officer. And being just recently, I've only been in this job for about 9 or 10 months, I recognize the importance of senior leadership in leading the charge. We used to use the analogy of a compass at Poudre Valley Hospital when I was there, that the compass was our infrastructure, And we would set our compass where we wanted north to be, and that was sort of our strategic plan. And the needle was the measurement of whether we were headed in the right direction. And really, it's the senior leadership's job to make sure that that needle stays on true north. But the problem is they can't do it alone. And until the entire organization starts to believe that their job is, no matter if you work in accounting, rehab, housekeeping, or whatever, that we're here to provide quality, safety, and service. That's our job. Until almost everyone in the organization starts to believe that, then you start moving, and your organization's there. I mean, you guys are doing a wonderful job, and the transparency of your data is outstanding. So I just want to compliment you on that. You had some other very positive things that were mentioned, including the wisdom work that you're doing, and I encouraged Joan to write an abstract for the Magnet Conference, which is coming up, because it's very unique work that you're taking your shared governance and moving it through your entire system, not just, a little bit of it. You're trying to move it through the entire system, which is impressive, and you've got a plan, and it's working. Although this is a nursing recognition, I think all of us here recognize this as a team sport. Everyone has to pitch in to make sure that your patients are cared for, and their family members, and the community as part of that. Just trying to think what else here I just wanted to cover. I think the other thing, though, is making sure that it's sustainable. And one of the things that when I was at Poudre Valley and I left is that I wanted to make sure that when I left there was an infrastructure, that it just wasn't me that was leading the charge. And it's quite evident when I was up on the floor and making sure, talking to some of your nurses, that they really believe in your mission and your vision, and they live your values. And I think that's important because I get to see a lot of organizations and their applications come through for Magnet. And I should say that not everyone who is designated gets redesignated. I get to make all of the very positive phone calls, but I also get to talk to some chief nursing officers that don't get redesignated. And you're one of about 42 or 43 organizations that have had, initial designation and 2 more out of 385 hospitals in the country, and we have 5 international hospitals now. So what you're doing here is very special, and you're very unique, and you're in an esteemed group of nurses and other healthcare professionals and the ancillaries. So I'm very happy to be here. We don't go everywhere because our schedules don't allow us to go everywhere, but I'm very happy to be here, be part of your celebration, and just through the tours get to experience what it's sort of like to be here. And like I said, hopefully I never have to go to the hospital when I'm in this area, but this would be the place that I'd pick, and if I was ever looking for a job, this would be the place where I would look to come, except for Poudre Valley. I have my roots there. So, but anyways, I just want to thank you for inviting me, and congratulations, and good luck with the celebration. Let's see here. Well, this is a fun part of the job too, is that we get Magnet organizations get a plaque, and I'm not sure, do you display your plaque prominently? I hope so, because it's a big deal. It's a huge accomplishment. So I just want to formally hand over the plaque, Bonnie, to make sure that, oh boy, these things are heavy, aren't they? And congratulations of the hard work. Initial designation is hard. 2 designations is a lot of work to make sure that you're sustaining the quality, customer satisfaction, and continuing to keep it moving through your system. So having 1 of these is impressive. Having 3 of them is even more impressive. So congratulations.
Thank you, Craig. I'm delighted to welcome our next guest, Keith Nevitt. Keith is here to speak on behalf of Congresswoman Tammy Baldwin.
Thank you, Bonnie. My name is Keith Nevitt. I'm a field representative for Congresswoman Baldwin, based here in Madison. I have the, although I don't have the industry connection, perhaps, that Craig does, and I have the honor of getting to work with Dr. Byrne and many members of the staff here over the past couple of years. And Tammy is sad she couldn't be here today. She's back in Washington dealing with Congress and all that goes along with that. And sure she would much rather be here talking to all of you than out there. But she, is a champion of healthcare her entire career, and I know through her and through my own work that we are so lucky to have the healthcare community we do here in the 2nd Congressional District, but especially St. Mary's. And I think it comes to nobody's surprise when we hear St. Mary's has won another award. It's kind of to be expected at this point because of the high quality of care, leadership, staff, volunteers, and everything that goes on here. So I'll keep it short. The Congresswoman did send a letter here with me today, so I'll read that. Dated January 19th, 2012. Dear friends, although I could not be with you in person today, I'm proud to honor St. Mary's Hospital for receiving their 3rd magnet recognition from the American Nurses Credentialing Center. Magnet recognition acknowledges the high quality of care provided by the nurses at St. Mary's. However, the award also speaks to the excellence of the overall organization. In their review, the ANCC acknowledged St. Mary's high patient satisfaction scores, outstanding organizational leadership, and dedication to innovation, amongst many other exemplary areas. These are areas in which St. Mary has long been an industry leader, and I look forward to them continuing to be a leader for years to come. Because I know what an excellent organization St. Mary's is, I'm never too surprised to hear it has won another award. However, this feat is truly remarkable. The rigorous application process, like Craig spoke to, complete with extensive written documentation and on-site visits, makes it difficult to attain magnet recognition once, let alone 3 times. To put this achievement in some perspective, only about 7% of hospitals nationwide are designated magnet hospitals, and less than 1% have ever achieved magnet 3 times. The quality of care and dedication of the staff at St. Mary's are 2 more reasons I am honored to represent the 2nd Congressional District of Wisconsin. And for the 3rd time, I offer hearty congratulations to the nurses, doctors, staff, and volunteers that work to make this hospital a prestigious magnet hospital. Sincerely, Tammy Baldwin, Member of Congress. Thank you.
Thank you, Keith. So our next guest is a physician at Dean Clinic in the Department of Cardiology since 1996, and he is the current medical chief of staff. And I have had the honor of working side by side with him in the MICU. So please help me welcome Dr. Brian Bachhuber.
Well, I always like to give a few anecdotes, and one of the things that I remember about St. Mary's actually was as an undergrad. In Madison, it was always a women and children's hospital back in about the late 70s, and we've really grown up a lot, both from the staff standpoint, from the nursing standpoint, from the physician standpoint. It really has now become a leading-edge tertiary care center in the region, and it really has taken a lot of effort both on the part of nurses, physicians, and I think one thing I knew when I came to St. Mary's is it was the right spot for me was the fact that medicine is really a team sport. If you don't have good nursing staff, if you don't have good physicians, you might as well call it a day. So from this standpoint, I congratulate the nursing community, both in our hospital and locally in terms of their effort every day that they give to us, and also to the amazing accomplishment here at St. Mary's of being designated again the 3rd Magnet Award. Thanks very much on behalf of all the physicians and the staff.
Thank you, Dr. Bachhuber. Well, since coming to St. Mary's in 2004, our next speaker has overseen the completion of a major hospital expansion, the transition to an electronic health record, the opening of the state's only freestanding emergency room, and the transition of the hospital to a whole system shared decision-making model. As president of St. Mary's, Frank is moving us forward in this changing healthcare environment so that our philosophy of patient-centered care always remains the focus. Please join me in welcoming Dr. Frank Byrne.
I just need to clarify something. When Bonnie uses the word oversee, what she means by that is stay out of the way of the people who really know what they're doing in all those endeavors. And I'm proud to be able to stay out of their way and be grateful to be here. Before I say just a few words, I'd first like to have the folks here who are volunteers, auxiliary members, community members, and foundation staff raise your hands, please. Our business partners, folks here from the community. That includes you, Sarah, Gary, there you go, Joe, there you go. On behalf of all of us at St. Mary's, we want to recognize you. Let's thank our community representatives. As Bonnie mentioned, community is one of our SSM values, and it is all about community. I'm the grandson of a nurse who gave me my first job in healthcare as a nursing assistant in a skilled nursing facility in the summer of 1972. The most satisfying and meaningful experiences of my career thus far have been centered on collegial and collaborative teamwork with nurses, physicians, and other professionals, and I stand here today as much in tribute to them and what I've learned from all of my colleagues over the years as anything else. Those are just two of the many reasons I could share why I personally find our magnet redesignation important, meaningful, and gratifying. I'm proud to be part of an organization that's one, as Craig said, of only a small number of organizations who have achieved 2 magnet redesignations. I'm proud of the connection to our past that means and the healing heritage of the sisters who came here and opened this hospital 100 years ago. And Bonnie has talked about our connections, our history, our past. The most important thing about this, however, doesn't relate to the past, it relates to the future. The fact that as part of a magnet redesignated organization, we are prepared to do the hard work that's ahead of us to get where we need to be to meet the needs of those who will continue to depend on us into the future. I want to thank everybody who was involved in the application process. Bonnie provided exceptional leadership throughout that process, including the tours and accompanying the surveyors. I want to thank them for their accurate portrayal of our work here so that we could earn this redesignation. But I really thank and congratulate all of us at St. Mary's because, as Craig has pointed out, this prestigious designation is a tribute not only to our exceptional nursing organization, but to the entire organization. So congratulations and thanks to all of you.
Finally, our last speaker, and I may need a tissue when I say this, because I don't have one. Finally, it is my honor and my privilege to introduce our last speaker. Those of you who know me. And those of you who don't, this is me. Without her vision and support, this celebration would not have been possible. As the Vice President of Patient Care Services, Joan has led the transformation of the St. Mary's organizational culture from hierarchical to participatory, as she introduced the shared governance model of St. Mary's Nurses 20 years ago. And she's led the hospital through this change ever since. Her steadfast leadership and her passion for the profession of nursing are evident in her commitment to develop, connect, and engage people in the work they do in order to produce exceptional patient outcomes. Please give a warm welcome to our Vice President of Patient Care Services, Joan Beglinger.
Thank you. I'm very pleased to report that there's very little for me to add to what's been said. Very inspiring and very encouraging, and I want to thank all of our speakers very much. And Craig, special thanks to you for making the trip to join us. It's very special having all of our guest speakers participating today. So let me simply say that earning this designation as a magnet nursing organization 3 times is a huge, huge honor for us, but it also carries really huge responsibility. The bar is very high for us, and we talk about it all the time. It is absolutely imperative that everything we do in service to our patients in our community reflects that we deserve to be called a magnet organization. We take the responsibility very seriously, and we are truly committed to consistently producing the kind of outcomes that would be expected of an organization known for excellence. The most important thing I'd like to say is really a reiteration of what several people have already said, and that is for us to deliver on the promise of our mission, which is exceptional health care, requires a tremendous contribution from everyone who's involved. No discipline accomplishes its work in a vacuum, and it is the incredible work that is done here every day by everyone in a cooperative spirit, making a difference for those we serve, that has resulted in this magnet designation. And because this is true, as Frank mentioned, our magnet designation is not a nursing recognition, but it is a recognition that we have earned together and that we all share. On behalf of our entire nursing organization, I want to extend our warmest gratitude to our physicians, our volunteers, every discipline, every department. You make it such a joy to practice here, and we could do nothing without you. In closing, I'd like to recognize and thank, along with Frank, all of our wonderful community partners who have joined in our celebration today. It is an honor to work with each of you to meet the needs of our community. Thank you, everyone, so much for coming and joining us today, and I hope you enjoy our reception. Thanks.
I just want to thank you all again for coming and helping us celebrate. There's still lots of food left there, so enjoy yourself. Thank you.
Thank you.